At these first results, we realized that there was a subset of patients that had an unusual picture, and in this group, the only remarkable finding was actually a decrease in alpha-2A receptors as opposed to an increase, which you can see in this group. So this is about 1/3 of the patients, and this is about 2/3 of the patients. And this kind of a division held up across a number of studies. We're not exactly sure what it means. And these were the patients who had predominantly fatigue as opposed to fatigue and pain. If we looked at the group that also had pain, we saw those same two subsets with the alpha-2A receptors going down and the alpha-2A receptors going up. But you can see the addition here of the blue bars, and we think this is a gene that's related to the expression of pain. You can see they have none of this before the exercise, and immediately after the exercise, at all the time points, there's an elevation of ASIC3 receptors, which we think have to do with pain and fatigue transmission. So I'd like to go through and show you just a little bit about the tremendous variability we have seen in our patients using this standardized bout of exercise and drawing gene expression markers after exercise, because this is not necessarily a fingerprint of the disease itself, but a fingerprint of the physiologic response to exercise in each individual patient. And there are many things to take into account, maybe their age, their gender, their medications, whether they're early in disease or late in disease, their level of fitness, and many variables may come to play that may vary gene expression. So in this first slide here, on the right, I'm going to be showing you control patients. This is our full group of controls. And on the left, I'm going to show you an individual's response to the exercise. And remember, their baseline levels are here, and each of these reflects a different blood draw of gene expression at 30 minutes, 8 hours, 24, and 48 hours after the exercise. So this is a young man, and I'm not going to spend time on him. I just want you to get a flavor for the differences from person to person. And this is a 20-year-old male who became sick in teenage years. We'd done a pretty good job, actually, of managing his pain symptoms. He had a lot of pain symptoms. He responded well to fibromyalgia drugs. As you can see, he's got a dramatic response here that we think is related to orthostatic intolerance. This is a middle-aged male who's predominantly like that first subgroup we talked about that has a decrease in alpha-2A receptors after exercise, peaking at the 24-hour mark. This is a middle-aged male that has a completely different picture. He is seriously ill and had a complex medical history that resulted in his syndrome. And you can see that he has a dramatic increase in markers. These markers here go off the scale of 10-fold after 8 hours compared to our control group over here. Here's a 23-year-old woman who can do 10 to 15 hours of music teaching a week. This is a 22-year-old woman who got sick when she was a teenager. This study was done in 2009. The first numbers suggest the date of the study. And at the time I put this talk together, she has just had her second child. She's severely ill, but is getting on with her life. This is a middle-aged male whose wife had to go back to work, and I put this up here because I wasn't sure if he really had ME/CFS or if he was depressed or had some other kind of a problem, because sometimes it's difficult to tell. But after this gene expression study, it became clear that this is not the picture of a malingerer or someone with atypical depression. We've actually done these studies in depression, and this is definitely the picture of someone who falls under the umbrella of ME/CFS. Male who looks like a weightlifter, but he's seriously ill, can't shovel light snowfall from his driveway. This is another male. I don't know why I put so many male patients up, in part because there's such a stereotype against male patients having this illness. This is a patient who used to be a financial planner and is pretty much about half his normal abilities, maybe a little bit less than that. Now, this is a woman in her 60s who's been ill for at least 20 years, and I think that her numbers are low. This is my theory, because she is a master of pacing. She lives on her own. She understands her illness very well and can control most variables in her life, and I think that brings her symptom level down. She's also worked on very, very gradual on fitness, so that you can see that she did not have as dramatic of a response to exercise as others. I put in a couple of other slides to show that we can combine gene expression with other testing. This patient, was a young man in his mid-20s, I think became ill in grade school. You can see that his gene expression marches up and peaked at the 48-hour mark after he exercises at this point. He had a very abnormal tilt table test and abnormal cardiopulmonary testing to match, which give us a set of clinical data from which to help him learn how to manage pacing and orthostatic intolerance. This is a middle-aged woman, and we were able to combine the information of her study with cardiopulmonary testing on serial days, showing a very diminished VO2 max that was even smaller on day 2, which is hopefully going to be a signature of this illness as well. Now, this next couple of slides I'm showing just to demonstrate, as Andy talked a little bit about how we might be able to use gene expression to predict who would respond to drugs, or maybe to assess the benefit of drugs. And in this study, the patient is her own control.